transcatheter valves. We talked about coronary disease, we talked about valve disease, peripheral disease. All of these therapies are designed to try and treat cardiovascular problems without surgery. And there's different ways, and things continue to evolve, and that's the one thing in medicine. That things continue to change. We learn constantly. We learn how to do things differently, and a lot of this learning, the goal is to transmit it. And it's not just one way. It's both ways. We're talking in sessions today. There's strong opinions. There's very strong leaders here in India that do a lot of procedures that, whether it's on the valve side or on the coronary side, that do a lot, and they have experience that we learn from, and likewise, and I think that's the goal. And TAVR has become very common in the U.S. It is done more often than open heart surgery to treat a valve problem, but at the same time, it's not always the right thing. And a lot of the teaching and education is about what decision making, not just the procedure. And I think the goal for this type of meeting is to sort of emphasize that. And I'm very fortunate, Dr. Grube here, as Srinivas said, was, you don't want to say grandfather, that makes him seem old.
Pioneer.
Pioneer. Pioneer is the right word, not grandfather. Pioneer of these technologies, and was involved in the first cases, and I don't know how many countries he's been to sort of help teach and proctor, and we're very fortunate that he's comes to us, I don't know how many times a year to India, probably 3, 4, 5 times a year, and is really been instrumental in sort of the technology moving forward, but also helping to rationally distribute the technology, educate people. Because the challenge with these type of technologies, especially in a country like India, where financial resources play a significant role, and that there aren't as much access to care. And then the physicians that do the procedures may not do that many because the technology itself is limited. So the way when you get better at something by doing it repetitively. If you don't do it repetitively, the way you get better is by courses and learning and transmission of shared knowledge. So I'll stop there and if you want to.